Hello, everybody, and welcome to another episode of our Aila Health Patient Spotlight series on living with long COVID. I am here today with Rebekah Grimes, a COVID long hauler who has battled and is battling with the aftermath of COVID-19 since early July 2020. And coming up on a year now of living on this roller coaster, Rebekah has experienced a myriad of symptoms from extreme fatigue to chronic cough, body pain, migraines, extreme GI issues. And we're really honored to have you here with us today, Rebekah, to share a little bit about your story.
Thank you. Thank you. Hi, everyone. So, my COVID journey started in early July 2020. And it hit me hard. But I was just, told to come home and rest and call or go to the ER if things got worse. So fast forward 6 weeks out, I could barely walk. I knew I needed medical attention. I've had pneumonia and pleurisy before, so I knew that my lungs were in bad shape. So off I go to the ER and told the doctor, that I had a positive COVID test. He asked when. I told him the date. He said, "There's no way that you're still sick."
Mm-hmm.
And I said, "Well, I am sorry." And he was just going to let me go. Well, I was not leaving there without a chest x-ray because I knew that my lungs were in bad shape. And of course, he comes back in, says, "Ms. Grimes, you have COVID lung." Okay, what is that? My lower lobes were full of the yuck, whatever. And so he just gave me a Z-Pack and sent me on my way. So, still just horrible. Nursed myself at home with the Z-Pack and was still confused, at that time. I kept thinking, at that time there weren't many of us, and the support groups were small that I found on Facebook. And then, you start digging because that your body is sick, but you don't know what's going on. All these other people are either sadly passed away from that terrible disease or virus, or we're here and still dealing with it. So it's been just a nightmare, a roller coaster from hell. It's hard to describe unless you've been in that position to someone.
And this is still a roller coaster that you're on, right? What is life like for you today?
I have good days. I have horrible days. Today is not a great day. I had a really busy weekend, and as you know, if we push ourselves, we just fall flat. And these past 2 days, I've just been past exhausted. Backtracking to last year, I went to the ER that 6 weeks out from my positive result, but then I didn't seek other medical attention until September. So that's when I started going to an actual doctor and telling her my story. And, I'm in a small town. She said, I'm the only patient she had seen that has still had complications. And then on the Facebook group, I found the only COVID clinic here in Alabama, which is at UAB. And gratefully, I got in. And I started seeing them in January of 2021. And that's when, I started actually getting help with the respiratory part of it. Because my general practitioner here, it was just out of her scope. She was sending me to all these specialists. So I'm getting tests run. I feel like I'm a guinea pig. I can't keep track of all the doctor's appointments that I'm supposed to be at, labs, everything. They're just trying to find out anything, and everything was coming up normal. So then they kind of start looking at the patient like, oh, is she crazy? Is she really feeling this way? So, and it's the same with all of us. You hear every one of us will say that somewhere along the line, some medical professional has dismissed them at some point. I've had pharmacists laugh at me here because, anyway, lots of people do not believe that COVID can actually do this, which, if you listen to the experts, and it's really no different, or there is a difference, but it's very similar to the post-viral syndrome, the chronic fatigue, HIV, Lyme disease, all of that. But I was a healthy 40-year-old. I was functional. I did things. I was fine. And then you just go from feeling like you're 80 and you can't do anything and you feel worthless. And it's just been an absolute struggle. But I'm so grateful to be here. So I'm,
Yeah, absolutely a struggle. And, you mentioned several things there with, the doctor's appointments and the tests on tests on tests and everything coming back normal, right? That's something we hear a lot from COVID long haulers. With that, myself is being one of those cases as well. So in this place of seeing the doctors, and you mentioned like literally people laughing at you when you're going through this. So how have you coped with that? How have you managed your health in that time of, okay, I'm not being believed?
I guess, well, honestly, just the Facebook support groups, finding other people that are going through the same thing. It was, and still to this day, you can look on there and there are people that are just now getting infected and they're asking these questions, and it's tough. So I hope that one day I'll get better, but I don't know. My body is just wrecked. It's just not the same.
And it sounds like you're still very much in it at this point.
Yeah. So my last episode, I had a EGD done, and the next morning I woke up with no voice, and I didn't have a voice from April 28th until the middle of May.
Oh goodness.
I didn't know why. So I'm going to speech therapy, and we're trying to figure it out. Turns out I've been on so many inhaler steroids. I had gotten thrush, and it started in my mouth, and then it traveled down into my, I had fungal laryngitis, and that was tough. So I'm just grateful to have my voice back, because at that time we didn't know what was going on. We didn't know if it was coming back or what. But I still have the extreme fatigue, the chronic cough, the GI problems. My stomach, I look 6 months pregnant because I have extreme inflammation. It's the worst, and we don't know why. But I get to see a specialist next month, so I'm just trying to hold out till then, and just, I don't know. It's hard because nobody knows, and then it takes a while to get in with these specialists, and so you kind of just waiting, nursing the symptoms and trying to maintain.
And you'd mentioned this support element, like the support that you're finding through these online groups as being really helpful in connecting you with other people who are experiencing the same thing or similar things. What have there been other things that you found to be supportive to you as you go through this health battle?
Just resting. I mean, I don't live around any long haulers that I'm aware of. All of my friends are fine. So I'm kind of just going through this alone. Even my doctor says that I'm the only patient that she has that is experiencing this aftermath of COVID. But I will say with the information that is on those support groups, I was able to give her one of the codes that they have to type in, and she was like, oh, it did come up. That's great. So she's learning, that she wants to learn. She wants to help, and she has helped a lot, because I know I'm not the only long hauler that just suffered at home with no medication, just going through the motions. And so.
And I think you're touching on something really important there with what you said about informing your healthcare practitioner as a way to advocate for yourself in the doctor's offices, because this is still something very much that's coming into the global awareness. The COVID-19 virus is still new, and really seeing like the aftermath of this post-acute sequelae of SARS-CoV-2 is now something that's being recognized in the medical profession. So I love that you bring that up, is finding something that is relevant to your to your struggle and your condition, and bringing that into your into your doctor's office and going, okay, here's what I found. Because these doctors, as much as we want them to have all the answers, like they're very much still learning too. And you said that you're in a very small town. The only COVID long haul patient, it sounds like, in the practice. Yeah. So, you mentioned something else really interesting too about, your friends are fine and everyone else around you is fine. How do you manage that in terms of, how much to share with people with your health struggles?
Right. So my friends are really supportive. I stay home a lot. I don't go many places, for a multitude of reasons. But yeah, my friends and family seem to be really supportive. And I'm happy that none of them got sick. So.
And for somebody who's listening in perhaps to this conversation and feeling like their battle is really overwhelming and they're struggling, Do you have any advice or any recommendations that you would like to, speak to that person who's just feeling very overwhelmed?
Yeah, just reach out. Yeah, the mental health aspect of it is very tough. Yeah, it's really tough. So I was diagnosed with PTSD some years ago, and but this, pre-COVID, I was doing really good, and since COVID, my anxiety is just, just horrible. And yeah, mental health. Yeah, that's tough.
Yeah.
And we've lost some online friends in our groups that have chosen a different outlet, and it is tough. So, and suicide is near and dear to my heart. So I just would hope that that person would reach out to anyone. And there's always someone on our Facebook groups that is willing, and we will, they will just shower that person with love. So my advice is to just hang in there.
Yeah. We have such a tendency as human beings to self-isolate and to feel like, okay, I'm the only one who's going through this. But in reality, that's not the case.
Not at all.
Not at all.
Not at all. Not at all. And I hope to be able to, I know we are meeting with lots of senators and trying to get bills passed and funding for research, and people help with financially, honestly, because lots of us can't work, and that's a big struggle. And so I hope to, in the future, be able to do more in that area. There are so many others that are just putting in so much time, energy, and effort. I give major props to them because I don't know how they do it. I can barely. They're amazing. So we have and people like you, that want to help spread the word about long COVID, because lots of people still don't even think COVID's real, as crazy as that may be. So but yeah, when I guess it's that whole invisible illness thing, which I've not, I've never been sick like this. So I didn't understand, and lots of people don't. So that's great that you're helping spread awareness.
I think there's such an overtone of support really coming from this conversation here, and just the importance of support and reaching into the community, whether it's like your physical like community that's right there, or virtual community, in this age where we have the ability to go into these virtual spaces and find community support, and to reach out. Don't freak out is something I like to say with with my students. Good. But because chances are you're not the only one struggling in this way, and from community we heal. So Rebekah, is there anything else that you would like to add into this conversation before we close?
I'm so sorry, but I can't put anything together right now.
Well, holding you in this space and in this very bad, this battle that is very real and very present for
It
you,
is very
like even
real.
in this moment.
Right. Yeah, I've had a tough day today. Been sleeping a whole lot. So I'm my brain is literally just not working.
I hear you
I
with
appreciate
that.
you. I don't know what else I can add. I apologize.
Well, no need to apologize, Rebekah, because this is a very real part of the experience, and really want to thank you just from the bottom of my heart for taking the time and in more importantly the energy to be here and just to share your story and just bring awareness around long COVID. So thank you so much for being here.
Thank you so much.